Hi, this is Dr. Shantaponsel, founder of Atrial Fibrillation Centers of America and electrophysiologist. I'm a heart rhythm specialist, and today I want to continue on our last blog in which we gave an introduction to what atrial fibrillation is. Today, I'm going to be speaking about a few points. One, what is the symptom associated with atrial fibrillation? Two, what is some of the terminology that you may hear by your physician or other healthcare providers for your atrial fibrillation? And three, what is the normal progression of atrial fibrillation for you? Symptoms for patients that have atrial fibrillation can be highly variable. There are some patients that are asymptomatic, which means that they do not feel their atrial fibrillation. They're completely asymptomatic. There's patients, however, that have a lot of symptoms. One of the most common symptoms is shortness of breath. One of the studies that I looked at, approximately 60% of patients that have atrial fibrillation will experience some level of shortness of breath. There's other patients that experience palpitations, chest pain, or fatigue. Remember, with atrial fibrillation, the top chamber of the heart, instead of beating like this, is now quivering like this. When it quivers, you lose about 20% of your blood flow, and therefore it can cause a lot of symptoms. In the clinic or in the hospital, they may throw around some terms to describe your atrial fibrillation. The first is paroxysmal atrial fibrillation. This is a type of atrial fibrillation that can last minutes to hours to days. Persistent atrial fibrillation is one that lasts typically at least 1 week's time. Chronic atrial fibrillation is atrial fibrillation that will last at least 1 year's time. It is easiest to treat atrial fibrillation when it is paroxysmal rather than when it is set. There may be other terms that you hear as well to describe atrial fibrillation. One is lone atrial fibrillation. This is atrial fibrillation there despite having no other medical issues, such as high blood pressure, high cholesterol, blockages in the heart, and the only medical problem you have is atrial fibrillation. Post-operative atrial fibrillation. After you've had a surgery such as abdominal surgery or heart surgery, your heart is under a high adrenergic state, or there's a lot of adrenaline pumping, and that can drive the heart into atrial fibrillation. There's vaguely mediated atrial fibrillation will happen after a heavy meal or a nighttime. Atrial fibrillation will typically progress from paroxysmal to persistent to chronic over 1 to 2 years. And that knowing where you are on the spectrum is very important to understanding what are the best treatment options and also the medications. Atrial fibrillation is a complex disease, and understanding different aspects to it, the different terminologies, and what your symptoms are is a crucial part in dealing with atrial fibrillation. This is Dr. Shantaponsel from Atrial Fibrillation Centers of America. I hope you subscribe and like to our video. Please visit us at afibamerica.com. Thanks for watching, guys.